Welcome back. We are talking about sickle cell disease with Dr. Kathleen Elliott. We want to start here. So there is a difference between sickle cell disease and sickle cell trait. Could you go ahead and explain the differences?
Yes, so there is a sickle cell disease is different from sickle cell trait. So people with sickle cell trait only inherit one sickle cell gene and typically do not experience the symptoms of disease. However, they can pass the gene on to their children. And if two people with sickle cell trait have a child, there's a 25% chance that the child can have sickle cell disease.
Okay. Going into some questions from viewers, I want to start here. Can people with the trait have pain symptoms?
So patients with sickle cell trait do not show signs of symptoms. There is some specific extreme circumstances where patients or individuals with sickle cell trait may experience some problems relating to sickle celling of their red blood cells. So high intensity exercise or physical exertion, if they are in high altitudes and dehydration. So those are examples of extreme situations where patients with sickle cell trait can have some symptoms, but for the majority of patients living their life with sickle cell trait, they do not experience the symptoms.
Okay. Next question here from a viewer. How does sickle cell trait affect people, and are there precautions to take?
So the precautions that they have to take is just being mindful of putting themselves in extreme exercise situation, maintaining their hydration, and being aware of extreme temperatures that can sort of affect them. But if they're living their daily life, there's no precautions that they need to take.
Okay. If you have sickle cell trait, is there a chance to actually develop the sickle cell disease? Another question.
No, it's unlikely if you just have one disease that you will not develop sickle cell disease. If you have one gene, excuse me, let me clarify that. So if you have sickle cell trait and just have one disease, one gene, you will not go on to develop sickle cell disease.
Okay. Next question. I was diagnosed with sickle cell trait C, and so is my 2-year-old son. What does this mean for us?
So I would recommend that you follow up with your doctor and also your son follow up with his pediatrician so that both of you can be monitored closely. Um, and again, they can tell you about situations that I alluded to, these rare situations where there can be some problems. Um, but good following up with your primary care provider is what I would recommend.
Okay. And someone wants to know if you yourself treats patients.
I do treat patients with sickle cell disease, and I do follow some patients with sickle cell trait.
Okay. And I want to go back to donations. Why are blood donations so important for people diagnosed with sickle cell disease?
So one of the hallmarks of treatment for patients with sickle cell disease is getting blood transfusion. Because during these crises, there is sort of damage to their red blood cells, and so they require frequent blood donations, frequent treatment with blood donations. So um, it's very important for patients to have access to blood. And so that's where blood donations come in. And so that's how, if the community is looking to help patients with sickle cell disease, it's important to highlight the importance that blood donation can have in the treatment of patients with sickle cell disease.
Sure. What resources or support groups are available for people with sickle cell?
So there are lots of support groups available for patients with sickle cell disease in this area. Um, Highlighting sickle cell during this month leads to advocacy for patients, leading to better access to care, more research funding, and improved treatments. So it's all connected.
All connected. Okay, gotcha. And we have about maybe 20 seconds left. Is there anything else that you would like to add before we wrap up here?
I think that um, for some patients with cell disease can sometimes feel isolated, and it can take a toll on their mental well-being. And so if you know someone with disease, providing them emotional support is crucial. Um,
Yeah, that's beautiful. Thank you for mentioning that. Well, if you missed this entire conversation, remember you can find it on our website, WFMYnews2.com. Let's take a look at weather with Chief Meteorologist Tim Buckley.